Hi guys. I covered this topic in my recent live stream that I did just yesterday, but I thought it was worthy of a separate video because a member sent me an article with some really important information in it that I was not aware of before. The article was published in Whole Dog Journal, and it's about feeding bones to dogs. Now, there's nothing really remarkable about this article except that it shared some links that I had not seen before. Really important stuff. So, the member that sent this article to me had two questions. She wondered if my dog's teeth were clean and what I did to keep them that way. So, I'll just show you a photo of my dog's teeth first. Okay, so you should be looking at a photo of my dog's teeth, and you can see that there's just a little bit of yellowing near the gum line and on a couple of those teeth. And she is 8 years old, and she has been chewing on bones, mostly venison spine sections, since she was just a few weeks old. So if your dog does have tartar and their teeth do not look like that, don't be discouraged because you will be wanting to watch this video to the end because I have some very good news for you. Anyway, I will get to that later, but her second question had to do with whether there's any truth to the idea that dental disease has a direct causal relationship to organ failure or organ malfunction, like kidney or heart disease. And I will answer that question, but first I wanted to talk about a link that was shared in this article. This link was to a study, or actually two studies that were done on beagles that showed even chewing on femur sections can make a huge difference in tartar on dogs' teeth. And it's important to bear in mind that these kinds of bones are the ones that we are commonly warned against feeding by raw feeding experts and for valid reasons. I'll talk about that in a minute too. But there were actually two studies, like I said, and they were done in 2016. They were published in the Veterinary Journal of Australia. The first study took a group of eight 3-year-old beagles every day for 12 days, and they were given a piece of cow femur. In the first study, they used a portion of the bone that contains what is called cortical bone, which is the hardest part of a cow's leg. It's the middle part. Then they did a second study where eight more 3-year-old beagles were given daily a section of the leg bone that includes the epiphysis, which has spongier bone called the cancellous bone. It's the rounded part near the joint, or it's actually part of the joint, and it's part of what raw feeders would call a knuckle bone. So here's what they found. At the start of the studies, dental calculus or tartar covered 42% and 39% of the dental arcade areas, respectively. In study one, the chewing reduced the established dental calculus area by 35% after only 3 days. After 12 days, the dental calculus was reduced by 71%. In study two, the dental calculus was decreased by 57% after 3 days, by 82% after 12 days, and 89% after 20 days. So, in other words, in less than 3 weeks, almost all of the tartar was removed from the dog's teeth. The researchers noted that the cortical bone, the hardest part of the bone, remained largely intact after 24 hours. It couldn't be completely consumed, it's too hard. But the epiphyseal, the spongier bone, was reduced to smaller pieces and in some cases totally consumed after 24 hours. And that's the bone that had the best outcome. These researchers also reported no complications such as tooth fractures, pieces of bone stuck between teeth, or intestinal obstructions during the studies. And this, of course, is a very small study. So it doesn't mean at all that these bad things never happen. Still, it's worth noting that we hear so many warnings about bones instead of these incredible benefits. I have my suspicions about what motivates this because the vet industry makes a lot of money cleaning dental calculus off of dog teeth. So I will summarize those study findings along with my commentary. about them at the end of this video. But first, I wanted to comment on the member's second question about the condition of the teeth, representing some kind of risk to the vital organs. This has long been a story that the vet industry has used to corral people into submitting their dogs for teeth cleaning. And I've always been very suspicious of this idea because to me they simply look like coexistent symptoms. If a dog is fed such that he has periodontal disease, it's logical to conclude that the same factors that cause that problem are also going to cause organ problems. Where the research community makes its mistake is in assuming that when they find bacteria in the mouth that matches bacteria found in the organs, that there's automatically a causal connection or a pathway. And I say, not so fast. Some of us who understand the true role that bacteria play in disease know that they are the products of disease tissue, not the bringers of disease tissue. They are the cleanup crew, like flies around garbage and amoeba on stagnant water. So when I asked AI how this alleged causal link between these two conditions has been established, it said that there have been interventional studies that showed that dental cleanings and extractions lead to, quote, improved markers of systemic health supporting a cause-effect link, unquote. And that makes it sound like it's very clear cut, like the vet industry wants us to think. But it's not clear cut at all. And even the researchers admit that if you query further. More about that in a minute. So it seems very odd to me that vets are so eager to see this connection as having been firmly established when it hasn't been, and ignore other connections that are much more solid, like the feeding of kibble and the epidemic incidence of periodontal disease. So when I asked for studies demonstrating this causal link, here's what I got. Quote, this relationship between periodontal disease and systemic conditions is widely described as being bidirectional, unquote. So let me just take a minute and explain what bidirectional means. It means that these are two conditions or variables that affect each other. It does not mean that one is causal of the other. In other words, they're just coexistent conditions, both caused by the same factors that underlie them. So AI goes on to say, quote, but further research is still needed to establish causality. For the most part, the biological connection between periodontal disease and systemic conditions is unknown, unquote. So that means we can toss out the whole idea. And once again, the assumption that bacteria are causing the problem is creating bias and misinterpretation in the research that filters down to vets. And I think it's very clear from all of these studies that a causal link has not been established because even the researchers admit it. So, from my perspective, there is no persuasive link that having your dog's teeth cleaned is going to prevent organ damage. I'm quite sure there are millions of dogs out there whose owners dutifully submit their dogs for teeth scraping that still have organ failure. And I know that's true because properly fed dogs do not have to have their teeth scraped, just like my dog will never have her teeth scraped by a vet. She doesn't need it. So, just leaving that topic for now, for me, the biggest takeaway from reading this article is the studies that showed this enormous decrease in tartar from just allowing a dog to chew on a bare cow femur, the very bones that we're always being warned against. And to be honest, I still have to err on the negative side when it comes to feeding femur bones. I know for sure that they are problematic. So I think the big mistake that these researchers made in these bone studies is in their choice of bones, and that's because they're not raw feeders. Almost every raw feeder out there knows that cow femurs aren't the best bones to give your dog. And it's not surprising that researchers wouldn't know this because it's not taught in academia. You'll most likely never hear it from a vet because vets will just tell you that all bones are dangerous. In reality, however, what we can take away from that study is that the recreational chewing on bones is the key to resolving the tartar issue. We just need to make sure we select bones that are relatively safe, and we can do that we can minimize the risks and still enjoy the benefits. So I will post a link below to the article that contains the links and also a couple links that I used to research the information about periodontal disease and its supposed connection to organ problems. I also have a section in my book that explains which types of bone that I recommend and why. Thanks for watching.